Hello, I'm Dr. Brenda Kofelt. There's a lot of talk out there about COVID-19 or coronavirus. It can be overwhelming and scary to think about. I'd like to share some facts with you that can be hard to hear. I'd like to share who is at highest risk for getting seriously ill from COVID-19, what the treatment options are and how well they work, and what is important to think about and do right now. In the next several months, it's expected that many of us living in the United States will get COVID-19. Some of us won't ever feel sick at all, even though we have the virus. Some of us will feel pretty sick within a few days of getting the virus. Most of us will be able to stay home and get well there. But a small number of us will be sick enough to need to go to the hospital. Some people have a higher risk of getting seriously ill from COVID-19. They are older adults and people of any age with serious health conditions like diabetes, lung disease, heart disease, or some types of cancer. But scientists are learning more about COVID-19 every day. Recent research shows it is even affecting some healthy young people in serious ways. People who get seriously ill from COVID-19 need to go to the hospital. Many who need to go to the hospital need only supportive care before they can go home. Supportive care means treatments like oxygen and IV fluids. But some people who need to go to the hospital may be told they need intensive care. They may have such difficulty breathing that the doctors will consider trying a ventilator to keep them alive. A ventilator is a breathing machine. Being on a ventilator is not as simple as it sounds, and sadly, it does not necessarily save lives. To be on a ventilator, a person has to be put in a medically induced coma. Also, this is not like other pneumonias. COVID-19 is more serious and can cause serious permanent damage or death. That's why it's very important for all of us adults to think about what medical care we would want or not want. Because a few of us may get so sick with COVID-19 that we may not be able to speak for ourselves to say what medical care we would want. For example, many people who are put on ventilators are very sick and won't survive or will have serious permanent damage to their lungs, heart, or brain. So it is important for each of us to think about if we would want to be put on a ventilator if that is the likely outcome. It's very important that we talk with our loved ones or someone we trust and our healthcare provider about what kind of care we would want if we were to get so sick with COVID-19 that we could not speak for ourselves. It is also important that we decide who will speak for us if we cannot speak for ourselves about the medical care we want. And we need to make sure that person is willing to honor our wishes. An advance directive is a form where we write what medical care we would want if we could not speak for ourselves. We also write who will speak for us if we could not speak for ourselves. Even if we have already filled out an advance directive form, it's still important to talk with our healthcare representative and healthcare provider about what COVID-19 treatment we would want if we could not speak for ourselves. Thank you for watching this video. Having reliable information can give us the power to make decisions that are right for us. To learn more about COVID-19, go to nextdoorinc.org. This message is brought to you by the Columbia Gorge Health Council and the Nextdoor.